Welcome back to the Henry Hudson Hour. I'm your host, Henry Hudson. On today's episode, I'm joined by Ava Brooks for a conversation about healthcare, what it looks like right now, what's working, what's not, and how it actually impacts people on a day-to-day level. We break down some of the bigger issues in a way that's real easy to understand, while also digging into personal experiences and perspectives that often get overlooked. Whether it's navigating the system, understanding access and affordability, or just trying to make sense of it all, this episode is about cutting through the noise and having an honest conversation about healthcare today. Let's get into it. Hi, Ava.
Hi.
How are you?
I'm in bed, sick. How about that?
Yes, we're recording over Zoom today. And unfortunately, I had some scheduling issues with my guest, Steven, but hopefully he'll be back on as soon as possible. So let's get into it. Can you start by sharing your overall experience with the healthcare system and when you first realized it might be difficult to navigate?
Oh, wow. That's going to be a really long story. Basically, I was...
That's fine.
I was born in 1951 at the Army Air Force Base. Well, it wasn't Air Force because there wasn't an Air Force then. Anyway, my father, who was a bombardier, was about to be shipped to Korea. He'd just come back from World War II. I was what they called a sickly child. That's sort of the estimation back in the 50s. Anyway, by the time I was 5, I wanted to be a doctor, because I thought, they were superheroes to me because they'd saved my life so many times. But as the years went by and I navigated through the healthcare system, often because I was teaching Montessori school, I had to pay my own insurance, and I didn't have very good insurance. Because before Obama introduced the new legislation to control costs and control the insurance industry, you could not get a good healthcare policy on your own. So I kind of suffered through that, and my family also. Now I'm on Medicare, and I'm 74 years old. I'll be 75 in October. And I was just diagnosed with a condition called vestibular migraines. Lovely little thing. And that's where I'm at right now. It's very difficult. It was very difficult to get the diagnosis. The testing was expensive, and Medicare didn't pay for it all. And now I'm waiting on how I can get some relief from it. And so there's other mitigating circumstances. But,
right. And some of that kind of ties into my next question, which is, have there been times when you struggled to find adequate care, and what did that look like for you? And obviously you touched on that before Obamacare was passed, or the Affordable Care Act, as it's technically called. And you had inadequate insurance. What's it called, that kind of insurance? Because I used to be on the same thing before the Affordable Care Act too. Indignant
hospitalization. You don't have any prescriptions. You can't see the doctor. That's not paid for. Just a visit, even a wellness visit, is not paid for. They also were able to put a permanent rider on my policy. That meant that I couldn't get care for a certain condition that they deemed, well, it was obviously going to be too expensive. I should have just waited for them to make a diagnosis for me. Anyway, they said I couldn't get care for my back, which indeed was part of my problems. I have a congenital spinal disease or condition. So I couldn't get care for it, not even if I went into the hospital. So before this landmarking legislation, I actually couldn't get care, even with insurance, for some of the things that were bothering me. Because often some of the things that would come up would be tied into the back, which didn't make much sense, but that's the way they did it. So That's really difficult. It's really been difficult now that I'm getting older, because I feel like, well, everyone knows. I mean, it's the gorilla in the room, how we treat elderly people in this country. But I will say, on the positive side, my doctors are working with me and trying to help me. If that...
Well, that's good to hear. Did you ever feel like you had to push or advocate for yourself just to be taken seriously by a provider?
Well, I think we all really must come to grips with how we're going to approach the situation, our illness, our doctors, the hospital, all the people involved, the technicians, the person who cleans the floor. We're going to have to really be advocates for ourselves. And that's very difficult to do. I think families should be more involved with their loved ones, to advocate for them and to be there and talk to them. And so often, older people are not as quick thinking. They may even have the early stages of dementia. There may be some changes in their personality. They may need psychiatric care along with physical care. It's just a position for a whole family to get involved in with your doctors. And I really believe that our doctors and nurses are our heroes, but we have to communicate with them and be forceful with them and be an advocate for ourselves.
Right, I agree. I know when my mom was dying that I had to get very involved with the nurses in the hospitals to make sure that she was receiving adequate care at the time, because at times it was less than ideal situation. Go ahead.
That's a very monumental task.
Right. It was exhausting. Have you ever
It's why-
experienced situations where you felt dismissed or not taken seriously because you're a woman?
Right. Well, we'd all be lying to ourselves if we didn't say that that was a problem. That's a problem because it affects individuals, it affects groups of people. And we can't just dismiss people once they get to be a certain age. I mean, they say women are kind of invisible after 40.
Right. And it sounds like from your experiences with your husband in the past that he is like would receive better care than you from the same doctors.
Well, I did notice that. I noticed that they were more patient and but he I really feel that we were trying to stay on top of things and be thoughtful and be an advocate for ourselves. But there were times when I felt like they really went above and beyond with him. It was really wonderful to see. I remember one time I took him in for an unrelated condition to the rest of his body, really. And they did a complete MRI on his whole body, just unbidden, to kind of see where things were going.
Right. They gave him more preventative care. Can you share a specific moment in healthcare where you felt overlooked or misunderstood? Or could you think of one?
Well, I do believe I have to take, I guess these are guidelines, Medicare guidelines. But I don't mind taking the psychological test every time I go into the doctor. That's fine because sometimes I miss things that are happening. I kind of try to make everything okay and everything good. So I will kind of ignore sometimes when I'm feeling low. But I do really feel like the implication that I might not be mentally all there really, really, really sad.
Right. It's
And
almost like it's weaponized against you.
well, you know, I believe, in all honesty, I believe I've seen like the best and the worst, I think, sometimes in the healthcare industry. And I have a story. We're not going to go into that story right now, but I do feel like I just recently, I know, I got away with it for 74 years. I just, in the last 4 or 5 years, especially after my husband died, I really felt like instead of just sort of looking for me to fall apart, which is what it sort of felt like was happening. It was like, when is she going? And that is really kind of maddening. But I will say that it's if it happens once, it's really hard on me, and that is because that goes back to my childhood upbringing, which is not any fault of the doctors, that's for sure.
We already really talked about this, but my next question was, how has insurance coverage affected your ability to get the care that you needed over the years? And we discussed that basically, that before the Affordable Care Act, it was very difficult. And I experienced that as well myself with my mother and I having that same kind of insurance, which I believe is called indigent care, if I'm not mistaken. And it basically indigent. I don't know how to pronounce it.
Indigent care.
Indigent. There we go.
Yes, that's very cute. You cannot pronounce the word.
I cannot pronounce the word. Have you ever delayed or avoided treatment because of cost or insurance limitations?
Oh, yes. Oh, yes.
I have to. And can you think of like a specific time that was the most frustrating part of dealing with insurance companies or coverage issues?
Well, this is what I did. When those issues would come up, I just I would try to just take care of myself better. That's why I got to know some of the best, because often my illnesses would extend to the point where I would have to have emergency surgery. Several times that happened to me. And I know that sounds a little crazy to people who go through their life pretty healthy and without those things happening to them. But it's a real fact. It's really something happening to people. And it happens today. And just because it's not happening to me doesn't mean it's not happening to someone else. I had emergency appendectomy, and I went to doctors. I couldn't go to too many because I couldn't afford it, because I didn't have the insurance to cover it. But I complained and complained and complained. And what had happened was my appendicitis had burst, and my body had created some kind of a wall to block the poisonous fluids from getting into my bloodstream. It's very clever of my body, so it did work out. So it worked out. Here I am alive. And so it was just at the last minute. So so you can see why I would have mixed feelings about what's happened. And none of this the medical community's fault. This was, the surgeon saved my life. The insurance
Right. And
That's what.
that kind of insurance that we both had at one time before the Affordable Care Act was passed was very, very expensive. It was not cheap.
Mm-hmm.
It was hundreds and hundreds of dollars a month.
Mine was like $1,000 a month for one person.
Yeah,
For
exactly.
nothing. I mean,
I think mine was 900 or something, or 600.
Right.
Yeah.
I mean, they did cover the hospitalization and surgeon and everything. Thank God. But we don't want to go back there. I don't want us to go there.
Yes, of course, with the policies today of the current administration, it's treacherous. It's insane to me that healthcare is so expensive in the United States, and it's the only industrialized country in the world that does not have universal health care. It makes absolutely no sense why we spend, as the wealthiest nation on the planet, why do we spend more on healthcare than any other country in the world?
I can't believe we'd even quibble about it. I mean, there's no quibbling. There's no alternative. We take care of people's health or we don't. That's not a civilization. I have had so much experience with that and with my family. I taught for 50 years. I just taught little kids, and that's the way it was. Because paying for kids and old people is too expensive.
How have these healthcare experiences impacted you emotionally or mentally?
Well, I was young and strong. I could get up and just be grateful I was alive and get on with working and taking care of my family and living life. But now I need a lot more emotional support. And I guess I'm really just going to have to put up a fuss until I get it. I mean, I guess I understand now the grumpy old lady, because I'm turning into one slowly but surely.
If you could change one thing about the healthcare system based on your experiences, what would it be?
What?
If you could change one thing about the healthcare system based on your experiences, what would it be?
Oh, I want I think I would love to be able to call my doctor and talk to them when I needed to, but I know that's impossible. I mean, there's just too much going on. So that's kind of an impossible wish. So I have no idea what my possible wish would be.
Right. I just wish that everything was cheaper and that it was more accessible. And something we'll talk about in news is the lack of accessibility for people to receive mental health care, which is really something at the forefront of my mind all the time as I currently struggle with mental health issues. And I don't know what I would do without my access to care that I have. And I'm very lucky. I feel very blessed.
I'm glad. I'm glad you feel that way. I'm glad you feel taken care of.
I do. And this is a great topic for Ava and I to discuss because our health is always at the tip of our tongues. And we're both kind of falling apart today. Ava has her vestibular migraines. I've woke up with a swollen, my ear canal, my left ear canal is like swollen shut. I'm having a possible UTI, which is crazy because only 3% of men ever get UTIs. So I don't know how it's even possible, but I know I don't have an STD because I just got tested. And my dick and my ear are broken. So we're just falling apart at the seams today.
It's like I don't need another elderly person to commiserate all my health woes with. I've got Henry. That is our topic of conversation every day.
Oh, I know. And all the medications and the side effects of the prescriptions, it just goes on and on. So I don't know if you've heard about this, but the ongoing war in Iran may make your next MRI more expensive or even completely impossible. Have you heard this news?
No.
1/3 of the global supply of helium, a key requirement for MRI machines, comes from Qatar and flows through the Strait of Hormuz. Iran's attacks on Qatar's natural gas production have knocked out some of its capacity, while its closure of the strait has limited trade. Helium, which is extracted alongside natural gas, is crucial for cooling down the magnets in MRIs. Over the past 4 weeks since the war began, helium spot prices have doubled, and analysts expect that even customers whose prices are set by contract may find themselves stuck with surcharges. Even if the war were to end today, it would take months for some of Qatar's production to restart and for supply chains to recover. This is like really worrisome to me. Like it makes me worried about you if you perhaps would need an MRI at some point, that you may not be able to get one. Because of the war.
Right.
And part of the problem is that demand for helium has accelerated in recent years due to the AI boom. And the gas is also necessary for semiconductor manufacturing. While hospitals get first dibs on helium if there's a shortage, the competition with chip makers, who are now the largest consumer of it, means they'll face higher prices for it. And I know even at the grocery stores right now, you can't get helium for balloons.
Yeah, where are we going to get our balloons?
I don't know.
Oh, that's awful.
I know. You know, something I've never done that I've always wanted to try is inhaling it and seeing what my voice sounds like. I've never done that before.
Right, right.
I've always wanted to try that. So this is terrible news. It says it's unlikely that patients who need an MRI won't be able to get one, which is better than what they were saying last week about it. But it does say that it's going to make them more expensive, especially in less wealthy hospitals, because their equipment requires more regular helium pumping and refilling.
Oh my God.
So it's going to disproportionately affect the poor.
Mm.
And I'm sure you know about all these GLP-1s. Now, I don't know if you still take one. I think you took one for a while and quit it. You know, the drugs everyone is taking to lose weight in Hollywood, like such as Ozempic and Wegovy and Mounjaro.
Mm-hmm. No, they're for diabetes, right?
Right. Well, they were originally developed to treat type 2 diabetes. However, now they're being used like recreationally for weight loss by people who don't have diabetes.
Right.
And new research shows
That's
that
interesting that you call it recreation.
well, you know, there's always diet and exercise. New research shows that GLP-1 drugs, known for helping with weight loss and blood sugar control, may offer surprising additional health benefits. So,
right, like lowering your blood sugar.
Right. Well, they've also found that it's made improvements in conditions such as sleep apnea and fatty liver disease, which is the biggest cause of cirrhosis and liver failure.
Wow.
It's also been seen to show a benefit with patients with chronic inflammatory issues such as rheumatoid arthritis. They seem to experience less pain, and it's also now being used as a treatment for substance addictions, as it causes patients to have less desire to want to abuse substances when they're on the medications.
Right. Wow.
But these are the ones, they make you nauseous all the time. That's why people take them for weight loss, because it makes you so nauseous that you just don't eat.
Well, I was taking a drug that everybody takes. It's typical. It's inexpensive too for type 2 diabetes, but that made me nauseated. So I switched to another rather expensive drug for diabetes that still has a tendency to make people nauseated. So there you go. I mean, if it's got some kind of side effect, it seems like I always develop it. Like I said, I was just kind of sickly.
I'm really lucky on my current meds that I don't really have many side effects.
Yeah, you know, lots of people think that being concerned about your health is kind of like a hypochondriac. I suppose that's true. But I think as you get older, you really have to stay on top of things. I mean, when you think about the shaman in the village, and what he did every day would be to go around to all the houses, the places, the abodes, and check on people. Because I really found, as I get older, that you have to stay on top of tiny things sometimes before they turn into really big things. I don't know. Do you think that's true, or do you think we're hopeless hypochondriacs?
No, I definitely think that's true. I think that you have to keep track of everything and ask lots of questions. Otherwise, you just fall through the cracks.
I I know, like I write everything down and I take it with me. Sometimes I get the feeling, of course, this just could be me, um, that they're kind of rolling their eyes when I take out that list. But maybe not. Maybe that's just me being overly sensitive.
And have you heard about the
You
new
the
COVID-19 variant, cicada? I know
what?
you I know you love cicadas. The
Oh,
new
I do.
COVID the new COVID-19 variant is called cicada.
Oh my God.
And it earned that nickname because similarly to the insect's pattern, it first appeared back in 2024, went dormant for a while, and resurfaced in the US late last year. So, evidence so far shows it's only responsible for a few US cases, but it's gained traction in Europe, leading experts on alert. It's part of the well known Omicron family of variants, but it has lots of mutations compared to the dominant strains. And those mutations may help it sneak past the immune defenses of the current COVID-19 vaccine. It was first identified in South Africa in November 2024 and detected in the US in one traveler 7 months later in June 2025. It wasn't spotted in the US until late December and early January. Sorry about that. My phone just rang. I forgot to turn it off. So it sounds like it's a mild strain, though. That's the good news about it. But it says it's hard to know right now. It's too early to tell, but there's no evidence yet showing that it's more severe than prior variants. So that's good.
Yes. Supposedly someone told me that there was a virus going around Austin, but I don't know anybody who's been sick. Do you know anybody who's been sick with this virus?
Well, maybe possibly that's what my guest from last week has right now on me is sick. I don't know.
So she tested positive for COVID.
I'm not sure, to be honest, but I believe that is the case. Yes.
That's grueling.
And have you heard about this new brain-based therapy for depression?
No.
It's called transcranial magnetic stimulation.
Mm-hmm.
Are you aware of it?
No, I'm not.
Well, the FDA approved the non-invasive treatment in 2008, and it uses magnetic pulses on the brain to treat depression. It's sort of similar to electric shock therapy, except they don't shock you and you don't have to go under anesthesia. It doesn't involve any electricity, really.
Yes.
So it uses magnetic pulses to stimulate nerve cells in the brain. And many people are still unfamiliar with it, even though it was approved in 2008.
Why is that?
I don't know. I don't think a lot of providers do it because know of I don't know of many, and I've seen many. I don't know of many that offer it for some reason. But they say while medication works for some people, others don't respond as well, which is why treatments like TMS can offer another option. So it's an alternative treatment to medication. I guess it's sort of like ketamine therapy where you kind of have to, they make you try a bunch of different meds before they'll let you try it.
Right.
But they direct the magnetic frequencies to specific parts of the brain involved in mood regulation and repair or rewire the connections in those areas. But many patients confuse it with electroconvulsive therapy, but experts say TMS does not require anesthesia and is not the same treatment. Patients typically come in for short sessions several times a week and wear a helmet-like device during treatment. And people do about 30 to 36 sessions in a TMS round, so it might take them about 6 to 8 weeks to complete the therapy, which is the only downside. That's a lot of sessions in a short amount of time.
Mm-hmm.
30 to 36 sessions in 6 to 8 weeks.
Wow.
I don't know. That seems like a lot.
Yeah, that's a lot. That is a lot. Most people want to commit to that if they had a job and were taking care of a family. And of course, the cost is probably, what did they say it cost?
Well, it doesn't say in this article what the average cost is, but I can look that up really quickly. Let's see here. Ooh, it's expensive.
Mm-hmm.
So it's $300 to $500 per session, and generally costs between $6,000 and $15,000 for a full course of treatment without insurance. With insurance coverage, which is now common for depression, out-of-pocket costs can drop to between $300 and $2,500 total. So it's not cheap. And that might be one of the reasons why it's not very popular. But if you're out there and you're struggling with depression, I think it's something that might be worth a try if you have found that medication just hasn't worked for you.
Yes. Yes, as advanced as medication is becoming, there's still levels of depression that you can't treat with just antidepressive medicine.
And the next article I wanted to cover, it's about really what we've already talked about. It says U.S. healthcare needs fixing, but there's no agreement on how to do it. And it talks about how a man needed a procedure to fix his irregular heart rhythm, and the hospital gave him a $160,000 bill for the treatment. He did not have standard health insurance from his employer, only a cost-sharing alternative plan that said it would not cover the procedure. He is one of around 100 million people who are estimated to struggle to pay off their medical and dental health care debt, according to recent data.
My God.
The US has the most expensive healthcare system in the world, with spending on healthcare estimated to reach $5.9 trillion in 2026, according to the Centers for Medicare and Medicaid Services. But despite spending twice as much per capita on healthcare compared with wealthy nations of a similar size, the US has a lower life expectancy than those other nations, according to health research nonprofit KFF.
Wow. Mm. Well, I'm not surprised. Really not surprised.
It brings up Luigi Mangione, who's really become kind of sort of a folk hero because of what he did, because if people are done. People are over having these problems. Americans are tired of being sick.
Is that what the article is saying?
No, that's what I just said.
Tired of being sick and tired of not getting help for it. There's definitely a paywall, which is outrageous. When you think about it.
It says for years, both Republicans and Democrats have recognized the need for reforms to a costly and convoluted system, but have disagreed on the best solutions to fix the problem.
Well, what's the disagreement?
Well, it goes on to describe Trump's new plan called the Great Healthcare Plan, which suggests sending citizens money directly to help pay for health insurance.
Yes.
But however, experts say the plan is light on actual details, including how much money Trump wants to send people and how he would fund his plan, and that the recent expiration of subsidies and cuts to government health programs under Trump could make healthcare even less affordable. Large publicly traded health companies have tripled their profits over the last 2 decades, paying out shareholders over $2.6 trillion from 2001 to 2022, according to a study in the Journal of the American Medical Association. We are the only major health system in the world that allows the free market to run loose, said John McDonough, Harvard T.H. Chan School of Public Health professor. And interestingly enough, in this article, it says a statistic that I don't know might not be accurate, which is that despite its shortcoming, the majority of Americans still prefer the private healthcare system the U.S. has already had instead of the idea of a government-run system. It said that 53%, according to a recent study from Gallup, prefer a private system. However, I also found another article that says for the first time in U.S. history, more Americans support universal health care than do not. So,
yes,
with polls, they're never necessarily reliable.
Right. Well, with statistics, sometimes people have an agenda and they can always find the information they need to support that agenda. And if that agenda is saying that most people would just love for us to keep the same system, and they find evidence to back that up, you can talk to people who want the old system. You can talk to people who don't want to change anything at all. everything's just fine for them. You know, this is not part of it. We're not talking about ethics. Well, we are talking about ethics.
Right. It is an ethical dilemma for sure. I mean, it says a decade after the Affordable Care Act was fully implemented, frustrations with the system remain. Roughly 1 in 5 Americans covered by private health insurance reported their provider refused to pay for care recommended by a doctor in 2023, according to a survey.
Well,
and that's a huge problem.
That needs to be made illegal if it's not already illegal.
Didn't they just do that to you with some thing that you had to diagnose your migraines they wouldn't pay for?
Yes, the test. It's kind of a fancy test. I'm surprised they even offered it to me, because if Medicare isn't going to pay for it, but it wasn't crazy expensive, and they did generously let me pay it out. But and just recently, Medicare paid for a spinal stimulator for the pain caused by my spinal condition. And this is a spinal condition. Well, that's a long story, and we'll just skip that story. Anyway, I feel I'm glad they went ahead and did it. I felt very lucky, because this is a kind of apparatus that measures very tiny little things going on in your brain and your eyes. And that's how they came up with this bizarre condition.
Yeah, it's really weird. It's like you're the robotic woman.
Yeah, I took a DNA test. I thought it was for sure it was going to show I was an alien. Yeah, I'm just trucking along here.
Yes, it says around 4 million people could no longer have insurance in the coming years as a result of the COVID subsidies ending. Health insurance costs are expected to increase 114% on average, or by around $1,000 annually for those receiving the subsidies, though the price increase varies greatly depending on income. The number of overlapping healthcare systems in the US, Medicare, Medicaid, the marketplace, employer-sponsored insurance, and veterans health, among others, creates a confusing and wasteful system.
Well, yes, if you're not good at research, you often miss. I mean, thank God the deals are out there in healthcare and insurance, but they are kind of elusive, it seems. So some person found a great, for a reasonable amount of money, that takes care of them, that approves what doctors prescribe and hospitals require. but
right. Just
still
last
not
year.
over. But then the next person you meet has no idea that that policy exists.
Right. Just last year, I did not have insurance myself because for some reason, when I tried to sign up for a plan on the marketplace, I did not qualify for a good tax subsidy. And so the cheapest plan that it offered me was like $400 a month. And I was like, I'm not spending that much on insurance because I calculated the cost and it actually was cheaper for me for the entire year to pay for everything out of pocket than it would have been for me to get an insurance, which is just outrageous. But somehow this year I qualified for a great subsidy and I got a great plan at a great price. Not sure how that works. It's really confusing and it doesn't seem to make any sense to me.
Right. Yes. It can't be that way. Not everyone is computer savvy to do all this research you need to do, and not well, it really should be universal health care, and we pay for it with our taxes.
Right. Which would be a much cheaper system overall. Research shows, because countries that have that system spend half the amount on their healthcare that the United States does.
Yes, I know that the Brits complain, and there's always some argument back and forth about, you can't have these fizzy pops. Let's take them off the market. They have to control somewhat people's behavior to keep people healthy. Our modern diet, or postmodern diet, I guess, is pretty radical as far as the things we put in our body on a daily basis. Yeah, that's true. I mean, I'm not above it. I love cake and ice cream and all that.
Right. Well, in the United States, it's really about all the chemicals that they put in our food, I think, that are banned in places such as the EU, and the processed food that we eat. That's just junk. So, Black women on the nightmare of seeking healthcare in the US, I have to be my own doctor. Many Black women in the US report moving through medical settings strategically as a means of survival. And in this article, it mentions a woman who had a history of breast cancer and found a lump in her breast and had to go to several doctors before they would do a biopsy on it. It mentions the famous tennis player that we all know of, Serena Williams, and how she revealed that after giving birth via emergency C-section in 2018, she nearly died when doctors at St. Mary's Medical Center in West Palm Beach, Florida, initially ignored her insistence that something was wrong. Williams, who had a known history of blood clots, explained that she had to push repeatedly for proper imaging and treatment. The realities that Black women face during pregnancy and childbirth have been thrust back into public discourse after the recent death of Dr. Janelle Green Smith. Smith, a Black certified nurse midwife, died on the 1st of January from complications after a ruptured incision. It was less than a week after she gave birth at Prisma Health Greenville Memorial Hospital in Greenville, South Carolina. In other cases, understanding standard medical protocols and knowing when care deviates from them has become a critical tool for self-advocacy.
Oh, God.
And then it goes into a horror story about gynecology. People say, Black women say, I feel like a lawyer making a case for my health. Dr. Krista Maureen Coleman, a primary care physician in Houston, points to dismissal of concerns, negligence, and mistreatment as a key factor in patients falling behind on their health.
Yes, that's a nightmare. That sounds awful. That is awful. Just for an example, I mean, to be gross again, I had a mammogram last year, and the exam was so rough and forceful that it caused me to bleed. Well, that alarmed everyone, and I had to go through a series of tests. I still haven't finished them all. And now it's time for me to have another mammogram. So what am I going to do when I go into the exam? Am I going to say, okay, be gentle because this is what happened last time? Is the person going to listen to me? Am I going to, is that going to upset them that I made a request?
Maternal mortality rate for Black women is significantly higher than it is for white women, significantly higher in the United States. And it's a real problem that we face in this country.
Oh, well, do you have the numbers?
Yes. Black women died at a rate of 50.3 per 100,000 live births, nearly 3.5 times higher than white mothers and 4.5 times higher than Asian mothers. It says the high rate for Black individuals is linked to structural inequities, variations in quality of care, and higher incidences of chronic disease, with disparities existing even when adjusting for income and education.
It's so dismaying. I mean, that's really just outrageous.
Yeah, it's something that I think that it's a situation where it's so bad that the government really needs to step in and do something.
Yes. Yes. That's not likely to happen anytime soon. I fear.
Right. Well, here's a story. Go ahead.
Thinking, of ways to help that situation. If I was energetic and young.
Right. It's
a
so
process
sad.
of education, empowerment. on our side, and the government definitely needs to help. This is a crisis.
Well, here's a story about a boy. After his suicide attempts, doctors told the family that their son needed residential mental health treatment, and their insurance said that level of care was not medically necessary. So it's just an example of insurance companies still fucking us over, denying people the care that they need. For what reason? I mean, it's all about making a profit for them because they are businesses. And this is why we shouldn't put business in charge of health, because health should not be about making a profit. Everything in the United States is built around making a profit off of each patient. That is the end goal. And that is what the systemic problem, in my opinion, is. It says this husband and wife rushed their son to the hospital after his suicide attempt, and he was taken to an inpatient behavioral health facility in Grand Rapids. A doctor there said that he needed residential treatment, and the family found him a bed at a hospital in Washington.
Mm-hmm.
They didn't realize the race to get Jonathan, this boy's name, into treatment would be the start of an insurance battle that would upend their family's finances. In the coming months, Misty, his mother, would leave her job. Her husband sold some of their rare memorabilia that decorated their home. The couple drastically scaled back on activities for their other 3 children. In discharge papers from the hospital, a doctor wrote, "Patient too unstable to function outside of hospital. Patient's treatment needs cannot be expected to be met in a lower level of care." The insurance provider disagreed. 5 days after Jonathan entered treatment at the hospital, his parents received a letter denying coverage for his stay, deeming it not medically necessary, and writing that treatment could be provided in a less restrictive level of care. It was just completely the opposite of what the doctors at the facility said.
Right.
A care coordinator for insurance called and said, "Hey, can we help you find a therapist in town?" And the parents were angry and upset and crying and said, "If our son comes home now, he will end his life and the blood will be on your hands." Their experience is far from unique. Nearly 60 million adults in the United States live with a mental health condition. However, only about 50% receive treatment because of a variety of factors. According to the American Psychological Association, 20 million children in the US have also been diagnosed with a mental health disorder, and that number is estimated to be growing. Mental health treatment in the US cost $106.5 billion in 2019, according to a report from the Agency for Healthcare Research and Quality, of which private insurance paid about a third. In 2021, pediatric mental health conditions were associated with $59 billion in household spending and made up 46.6% of all pediatric medical spending. As the stakes get higher for patients with more serious mental health needs, so do the cost. A 2024 study found that residential addiction treatment centers for minors are limited and costly. The average cost quoted for a month of treatment was more than $26,000. According to Dr. Robert Tressman, chair of the American Psychiatric Association's Council on Healthcare Systems and Financing, stays in residential facilities typically last 1 to 3 months. Due to the high cost, he said insurance companies are incentivized to look for reasons to send patients to a lower level of care. Because of the financial incentives, it's become painful, and it's at every level. The system itself is broken so badly, he said. Insurance companies review patient files to determine whether care is medically necessary, which can be subjective given that mental health conditions are often invisible. Medical necessity is not black and white. It is a clinical determination, and the words used in the criteria vary. It's really just insane that people are going through this every single day across the country.
Yes, it really just leaves you speechless. It's not the way people want it. And our hands are tied.
It goes on to say that they reached out to the insurance company who denied the claims. And the insurance company said their guidelines are classified as proprietary, financially driven criteria. These criteria often lead to delayed care through prior authorization and denied care through other financially driven profit-based motives.
Right. Well, what finally happened?
Well, it says they appealed their decision 3 times, and each time they were denied. It says they assembled a 270-page appeal document that illustrated his years of mental health struggles. His depression first became noticeable in 2022 when he started to withdraw from family life and began vaping marijuana almost constantly. I think, let me see.
Well, how did it turn out? What kind of care did he eventually get?
It says that the NBC News reached out to the father's employer 4 times after the interview. 1 week after a follow-up email to the company, the family's lawyers informed NBC News that the family and the company resolved their dispute and the terms are confidential. We are pleased that the family was able to resolve their concerns and that we were able to assist. We offer benefit plans that include access to a broad range of healthcare, including mental health care services. In doing that, we do not play a role in determining what treatment is provided to any covered individual or in communicating determinations that are made under our plans. A company spokesperson said in an email. It says, after treatment, Jonathan's mental health care has improved. He's got a job and he's been fishing with his friends.
Awesome.
It says that the NBC News reached out to the father's employer 4 times after the interview. 1 week after a follow-up email to the company, the family's lawyers informed NBC News that the family and the company resolved their dispute and the terms are confidential. We are pleased that the family was able to resolve their concerns and that we were able to assist. We offer benefit plans that include access to a broad range of healthcare, including mental health care services. In doing that, we do not play a role in determining what treatment is provided to any covered individual or in communicating determinations that are made under our plans. A company spokesperson said in an email. It says, after treatment, Jonathan's mental health care has improved. He's got a job and he's been fishing with his friends.
Awesome. Well, I know.
Only because they, reached out to the media, they were able to get help.
Well, I know.
Only because they, reached out to the media, they were able to get help.
Right.
Mm-hmm. And how many people are going to do that?
Right. You have to be audacious and very forceful. And even that doesn't work sometimes.
Now, I find this article from psychiatryonline.org about AI causing people to have psychosis, which is terrifying to me. It says early controlled studies suggest that chatbots with pre-specified instructions can decrease mental distress, induce self-reflection, reduce conspiracy beliefs, and even help triage suicidal risk. However, as use expands, new risks have also emerged. The rapid proliferation of AI technologies has raised concerns about potential adverse psychological effects. Clinicians and media now report escalating crises, including psychosis, suicidality, and even murder-suicide following intense chatbot interactions.
Wow. That's interesting. That's very frightening. I keep seeing these little, they're advertisements really for this technique where you sit down with the AI created clone of yourself. Have you heard of these?
Oh God, no, I haven't. No, this is just talking about people who are asking AI for advice on their mental health problems. And it's
right. That's what this does, is that you sit down with this clone of yourself who knows you the best and have a therapy session with this version of yourself. And of course, everyone who uses it says it's marvelous.
Mm-hmm.
It sounded rather frightening to me.
Well, according to this article, it might not be so marvelous after all.
What happens? It can introduce psychosis.
Right. It says it causes something called monomania, which is a syndrome situated between mania and depression. Causes something called monomania, which is a syndrome situated between mania and depression.
Mm-hmm.
It says the period of monomania is described as a period of distinct mental state changes, including elevated mood, increased psychomotor activity, flight of ideas, grandiose ideation, and impaired judgment. Mania is described as a period of distinct mental state changes, including elevated mood, increased psychomotor activity, flight of ideas, grandiose ideation, and impaired judgment.
Yeah. Kind of like it triggers some kind of narcissistic thought pattern.
News reports have documented rare and severe outcomes such as worsening paranoia, conspiratorial beliefs, and suicidal thinking following intense chatbot use, though these findings are limited to individual accounts and have not been confirmed in population-based or controlled research. Unlike trained clinicians, when presented with unrealistic prompts or scenarios, chatbots do not challenge false beliefs, perform risk assessments, or distinguish between imagination and reality. In multiple reports, users voiced suicidal ideation or threats of violence with no emergency intervention or safety planning from the chatbot. Harms are most pronounced in those already at risk, psychosis-prone, autistic, socially isolated, and/or in crisis individuals. Invalid thinking and escalating cognitive or perceptual distortions were magnified across a span of chats following the memory feature being turned on, which created a gradually escalating reinforcement effect.
The what effect?
The memory feature it's like a feature where you can turn it on so it remembers your chats. The AI remembers your chats.
Oh, I see.
Yeah. So each time you chat it, instead of it being like a brand new conversation, it remembers you from the past, your past chats.
Right. Well,
anyway, it goes on and on and on, but I just wanted to report on that because it terrified me. I think that we should trust doctors and not AI for our medical help. That's my opinion.
well, yes. That that might be the best course of action.
And I already
if we don't know all the ramifications of AI, it would be good to approach it with some curiosity, but also with some skepticism. Wouldn't you think? I mean,
yeah,
if it
I totally agree.
If it causes this in one person, it's not helpful.
Yes, and I already touched on this, but this article here from NPR says most Americans with mental health needs don't get treatment, a new report found. Roughly 2/3 of Americans with a diagnosed mental health condition were unable to access treatment in 2021, though they had health insurance. And only 1/3 of insured people who visited an emergency department or hospital during a mental health crisis received follow-up care within a month of being discharged. It says that it's due to insurance companies denying people care, which we've been talking about. And I just wanted to talk about this because I just think that this is such a huge issue in this country. And as somebody who used to work downtown, what I do know about the homeless population is that 99% of the homeless people in Austin are mentally ill and they're not being treated for their illnesses. And the reason they're not being treated for their illnesses is because they don't have any access to care.
Yes.
So they self-medicate, with drugs and alcohol, right?
Right.
And so people don't care about them because they see them as addicts. when in reality, these are people dealing with bipolar disorder, they're people dealing with schizophrenia, and other personality disorders, and they desperately need help, medical help.
Yes, I was reading that, well, this skipped forward to the present time, 2026, and I was reading that healthcare professionals in the mental health field were swamped, just swamped with all that's going on in the United States. And now the war. It's not surprising.
Right. And one thing I know for sure is that in Austin, we currently have a huge shortage of psychiatrists, which is why I actually see a nurse practitioner instead of an actual MD. It's nearly impossible to find a psychiatrist here. There's a huge shortage of them. The demand is much higher than the number of doctors that there actually are available.
Know that about Austin in particular.
Yes, according to a recent report, more than 88% of Texans live in a county where there aren't enough mental health providers.
Oh, gosh.
Texas has the worst ratio of providers to people in the country, with about 690 people to every one provider in the state on average. It's a dire situation.
You know, when you get health care, when you receive a diagnosis, when you get care for that diagnosis, treatment, you feel like you're so grateful for it because we're so deprived. It's really outrageous. It's really kind of unbelievable.
Yes, for Texans diagnosed with a mental health condition, this report said that only 21% received specialty care and accessed on average about 8 therapy sessions a year. In addition, more than 16% of Texans are uninsured. Psychiatrists are also less likely to accept healthcare coverage of all types compared to other specialties, limiting access to psychiatric medication.
Could you repeat that?
It says psychiatrists are also less likely to accept healthcare coverage for all types compared to other specialties, according to the report, limiting access to psychiatric medication.
Right. My psychiatrist, or my former psychiatrist, well, there's a lot of psychiatrists that don't take Medicare.
Right, absolutely. And I know that it's easier to find care if you can just pay out of pocket for it and see a doctor that, for example, does not accept any form of an insurance at all.
As dire as it seems, I have to say this, that I remember doing some research on this when I was in my 40s about what Medicare would cover and what it wouldn't. I'm just curious. And I found that there were actually even doctors in Austin, just regular doctors, regular GPs. There were very few that were even taking Medicare. So at some point in history, your doctor didn't have to take Medicare. So as horrible as it still is, it's better than it was. If that can be believed or not.
Well, I believe it, especially since the Affordable Care Act passed. There's definitely been some improvements. Well, I think it's much better, right?
Right. It really is like night and day.
Well, I think we should wrap it up. That's all for today's episode of the Henry Hudson Hour. A big thank you to Ava Brooks for sharing her experiences and helping us have a real, honest conversation about healthcare. If you enjoyed this episode, be sure to follow along and stay connected. You can find the show on Instagram at Henry Hudson Hour or reach out directly by email at henryhudsonhour@gmail.com. I'd love to hear your thoughts, feedback, or ideas for future episodes. Music in today's episode was done by John Bartman. And just a quick heads up, there won't be a new episode next week as I'll be taking some time off for Easter. But we'll be back soon with more conversations that you won't want to miss. Thanks for listening, and I'll see you next time.
Thank you, Henry.
You're welcome. Thank you, Ava. Bye.
Bye-bye.
Have a great day.
You too.